Well, BP here. See this man right here? He was jailed for 17 years for leading, quote, one of the most egregious healthcare schemes in U.S. history. So apparently, this doctor had prescribed a lot of patients opioids and fentanyl and other various drugs. And apparently, it was all a scam. It was all a scheme to launder money and so forth. But I really think this is my honest opinion. I really think that they simply targeted him as sort of a drug lord. That's why they put him in jail for so long and charged him with so much money to pay back. It was like 30 million. Yeah, it says Frank Patino, 68, was also ordered to pay $30 million for leading a scheme to defraud Medicare and private insurers of more than $112 million by writing unnecessary prescriptions for opioids that left many patients addicted, reported the Associated Press. Okay, now a lot of people have mixed feelings on what addicted means. Okay, so addicted could mean a couple things. Addicted could mean something like an alcoholic who has a dependency, whereas if they don't get this particular drug, they'll die. Okay, you can die from, withdrawal symptoms and so on. Other drugs you do not die from. Heroin, for example. If you take heroin, you're not going to die from withdrawals. It's just going to be very unpleasant. Okay. I'm pretty sure most opioids, you're not going to die from them. Okay. Your body releases natural opiates. I don't know if I'm saying it correctly. When you masturbate, when you have sex, and so on. Okay. Your body generates this stuff naturally. Okay. You're not going to die from not masturbating or not having sex. Okay. Now, do I agree with the war on drugs? Absolutely. Okay. Good job to the government for taking a crackdown on drug dealers and so forth, because guess what? Drugs ruin people's lives. Okay. And to be quite frank, some of you need to be a little bit more cautious in approaching these types of people. And I'm going to explain why. The reason is because a lot of these patients who are quote unquote addicted, they're really not addicted. They're just trying to numb their pain. Okay. A lot of these people are terminally ill, which means they're not going to survive their cancer or their diagnosis of whatever it is that they've got. And guess what? Okay. Doctors and hospitals are not permitted to allow these, or to give these people lethal doses of morphine and so forth. Okay. They're not allowed to legally and mercifully kill people who are in pain. Okay. So what do these people do? They self-medicate. They self-medicate by going to the doctor, by going to the hospital. A lot of these doctors prescribing these drugs are actually doing so in a merciful sort of way. I'm not saying this guy is. I don't know. Maybe he was all about the money. Who knows? But there's plenty of stories out there where doctors and nurses will give lethal doses of morphine, lethal doses of fentanyl, lethal doses of whatever to patients so that they can die with dignity, so that they're not laying in a hospital bed for months and months and months suffering. Okay. Their family and friends, they'll try to talk to a nurse or a doctor that they trust, and they'll both agree to give this patient a lethal dose of morphine or whatever the dose is. Okay. That's not necessarily a bad thing, especially if they're at the verge of death. Okay. How do I know this? Read the last chapter of Proverbs. It says, him that is ready to perish, let him drink his misery away. Okay. The person that is on the verge of death, okay, the only access people had hundreds, thousands of years ago, the only drugs that people had access to were things like weed, alcohol, and maybe a few other sort of opiates and poppy plants and so on. Okay. But as a general rule of thumb, alcohol back in the day was used to numb pain, especially with people with terminal illness. Okay. So the point being, read the last chapter of the book of Proverbs. It talks about that. All right. A mother gives her son advice. Hey, don't drink. Okay. It's not for kings to drink alcohol. The reason why is because it'll destroy you. Okay. But give it to him that is ready to perish, is what it says. Give it to the guy that with terminal illness. So, in other words, hey, if people have a terminal illness, they're on their deathbed, they're out the door, they're on their way out. Guess what you should do as a hospital, as a doctor? You should give them the lethal dose of whatever drug will take them out. That's called a mercy killing, okay? That's completely opposite of what murder is. Murder is done out of malice, out of hate. Look it up, okay? People are charged with non-voluntary manslaughter and all kinds of accidental deaths and so on. Guess what? It's not counted as murder, okay? A mercy killing is not counted as murder. So that's what I'm going to say. Guys like this, I can't say he's a bad guy. All right. You can read the article, go on MSN.com, check it out. But who's to say this was a bad man per se? Okay. Do some digging, find out what was the motivation. Maybe it was money, maybe not. I don't really know. I typically don't defend people who break the law, but I will defend those people who give people, their patients, lethal doses of morphine, lethal doses of fentanyl, lethal doses of whatever, okay, who absolutely are beyond any hope whatsoever of getting better, okay? Why? Because why would I want to see my mom, my kids, or anybody else laying in a hospital bed for 6 months, 7 months, 7 years with no hope of getting better from this terminal illness? All right. So you guys really need to rethink your laws about this stuff. That's just my personal opinion. Who am I? Okay. I'm just a random guy off the internet. Okay. That's all I have for you. Thanks for watching. I'm BP signing out.